After almost 60 years of strong bipartisan support, Congress has cut all federal funding for public media, stripping away a critical pillar of support for local stations like ours. At Vermont Public, we'll lose at least $2 million this year. If all our sustaining members increase their gift by $7 per month, we'll close that gap for good. Increase your gift today and help close the gap at vermontpublic.org/update.
From Vermont Public, this is The Frequency. I'm Mitch Wertlieb. It's Thursday, August 21st, and here are today's headlines. Republican Governor Phil Scott is disputing the Trump administration's claim that Vermont is illegally providing safe haven to undocumented immigrants. U.S. Attorney General Pam Bondi has threatened Vermont with financial sanctions if it doesn't let state and local police cooperate with federal immigration authorities. Ava Ayers is an associate professor at Albany Law School, and she says it's part of a broader effort to enlist states in Trump's mass deportation agenda.
They're trying to bully states and localities into donating their time and resources to help enforce federal immigration law.
Scott sent a letter to Bondi this week that says Vermont is not a sanctuary state, and he says all of Vermont's law enforcement policies are in compliance with federal law. More than 700 acres of land has been permanently conserved as a community forest in Wolcott. Community members, Rhoda Bedell, and members of the Bourne family supplied the land. The Northern Rivers Land Trust will hold a conservation easement on the property, which sits behind an elementary school. Kate Warner is with the Trust for Public Land, the group that helped facilitate the project, and she says it conserves a major wetland along the Elmore branch of the Lamoille.
Conserving that and making sure that management of the property will always be forested and will always be managed with water quality and flood resiliency in mind is going to help all the downstream communities.
Wolcott put $25,000 toward the acquisition from funds in their American Rescue Plan Act, and state and federal grants covered the rest of the cost. There will be a grand opening of the new trail system on Saturday, September 13th. In an effort to address budget challenges, Bennington College announced late last week it will eliminate 15 positions. VT Digger reports this follows the college signing collective bargaining agreements with the three groups that comprise Bennington College United. 12 of the 15 positions being eliminated are union roles. The union will seek a meeting to discuss alternative solutions to the layoffs. The health department says Burlington's insurance plan will provide enough coverage for a proposed overdose prevention center in the city. The center would provide a supervised place for people to use drugs, the first of its kind in Vermont. Progress stalled in recent months due to insurance concerns. The state worked with the city to determine the insurance coverage it has is sufficient. The health department must now give Burlington more than $2 million to pay for the project. City officials are working with an independent research group to complete a community assessment this summer, and that will help determine a proposed location for the overdose prevention site. And volunteers in 2 Chittenden County towns are connecting their neighbors with local farmers. They're part of a group called the Jericho Underhill Food Hub. It started organizing after Jericho voters approved it at their 2023 town meeting. Underhill came on board the following year. Sandy Wilmot is a lead volunteer from Underhill.
Some of our farmers are like, we could feed everyone in Underhill and Jericho if people would actually eat local food.
Local farmers say one of the hub's recent marketing projects has been really helpful. The group sent out a pamphlet with info on local agriculture businesses this summer to every resident in both towns. Coming up, new research reveals the number of people being diagnosed with depression is on the rise in Vermont, coinciding with more kids and teenagers dealing with mental health issues. Vermont Public's Lexi Krupp digs deeper into the numbers after this. A growing number of kids and teenagers in Vermont are struggling with mental health issues. New research shows rates of depression diagnosed at a doctor's office or hospital in the state are rising as well. Vermont Public's Lexi Krupp recently sat down with host Jen Jarecki to share more.
Okay, so a lot of kids in Vermont report poor mental health. State surveys show that about a third of high school students say their mental health is not good most of the time or always. There's rising rates of self-harm and young people who make a suicide plan. So, Lexi, what does this new research show?
What's new here is researchers at Johns Hopkins School of Public Health went through claims data from health insurance companies for kids under 18. They looked at every time a practice or hospital submitted a bill to treat depression between 2016 and 2022. And they found depression diagnoses went up. They nearly doubled over that time, from about 4% to almost 7% of children and teenagers. So that's the big number here, 7%. And that's looking at data from nearly 100,000 kids a year in Vermont.
Wow. Okay, so rates of depression are high and rising. What else stuck out to you from the report?
There was a discrepancy between kids who were covered by commercial insurance and kids covered by Medicaid. That's a public program that insures people with low incomes and people with disabilities. It covers about a fifth of the state. And so kids covered by Medicaid had more than a 50% chance of having diagnosed depression, according to this research, even though they weren't actually being screened more. They actually had fewer routine visits to the doctor's office.
Is that because poverty can be bad for mental health?
Essentially, yeah. Researchers I spoke with said Medicaid is a proxy for economic status. So these are kids whose families are more likely to have job instability or unsafe housing conditions, less access to healthy foods, less time for recreation, all associated with poor mental health outcomes. But there could be some other explanations here. One is billing practices. Providers who serve Medicaid populations might bill for more diagnoses to get better reimbursement, according to some of the clinicians I spoke with.
Okay, Lexi, can we step back for a sec? Why are mental health disorders among kids increasing across the board?
So this problem, it's not unique to Vermont or even the U.S. Youth mental health disorders are on the rise globally. And researchers have a pretty good idea about why. Disconnection, bullying, financial insecurity, and heightened expectations. The research is pretty mixed about the links between social media use and depression. But there is a lot of really good research about what interventions can help. A lot of those start early on. So things like universal home visiting programs. That's in-person support for pregnant people and families with young children. There's also teaching emotional regulation in schools. Those are often called social emotional learning programs. Another researcher I spoke with is Professor Ramesh Raghavan. He studies mental health at New York University and has spent his career working on child mental health issues, including for the Obama administration. He lives in Dorset, and he said a big part of promoting child well-being is just letting kids be kids.
What that means is children have to react with gaiety, spontaneity, curiosity, those things that we think of as intrinsically childlike, we have to preserve.
And he said living in Vermont, in our very rural state, there's some unique opportunities to do that, like letting kids explore outside and take advantage of the natural resources here.
You've been hearing from Vermont Public's Lexi Krupp and host Jen Jarecki about new research showing a growing number of kids and teenagers are struggling with mental health issues in Vermont. Thanks for listening to The Frequency today. We had additional reporting from Peter Hirschfeld, Abigail Giles, Jen Jarecki, Howard Weiss-Tisman, and Elodie Reed. Today's episode was edited by Stephanie Colombini, and our music is by Blue Dot Sessions. I'm Mitch Wertlieb. Talk to you tomorrow.
These days, there's so much news, it can be hard to keep up with what it all means for you, your family, and your community. The Consider This podcast from NPR features our award-winning journalism. 6 days a week, we bring you a deep dive on a news story and provide the context and analysis that helps you make sense of the news. We get behind the headlines. We get to the truth. Listen to the Consider This podcast from NPR.